I got to see where I'd be in a few years from now. And that was the most profound thing to me, to actually get hands-on experience. So I know what I'm looking forward to. I know what it's gonna be like when I go into the medical field.
That was Ayannah Fernandez, a high-achieving high school senior with aspirations of becoming a surgeon. Over the last few months, she and more than 60 other New York City teens have been shadowing healthcare professionals at different hospitals within Northwell Health. These paid internships are part of a new program from the city's Department of Education called FutureReadyNYC. I recently sat down with Ayannah and Suravi, two participants of this exciting new program, after one of their rotations at Lenox Health Greenwich Village. Also joining us was Northwell's Vice President for Workforce and Community Education, Brian Aquart, who helps to oversee the program. So let's jump into it. Here is my conversation with Ayannah, Suravi, and Brian Aquart. Welcome to 20-Minute Health Talk.
Thanks for having us.
So, Brian, talk to us about Future Ready NYC. How does Northwell fit into this?
Absolutely. So Future Ready NYC is really a signature initiative of the mayor's office. There's the student pathway program that they've outlined, and it's really a two-pronged program. One prong is really about apprenticeships. The other prong is Future Ready NYC. And what Future Ready is it takes into consideration the whole high school, right? So we have 9th and 10th grade. They focus on career exploration for 4 high schools that we've adopted, right? We have health professions, international, urban assembly, and international. And then 11th and 12th is focused on Spark Challenge, Work-Based Challenge, and then really our internship component. And that's where, Suravi and Ayannah, they've been a part of. And so from April 3rd through May 26th, each school will be going through we've broken them up into 2-week cohorts where they will have like the EMS rotation. They will have a healthcare roundtable rotation, which is really comprised of the lab and other areas within the health system. And then they have this nursing component. We've given students an opportunity who have already shown interest in a healthcare pathway to get rotational experience throughout a variety of areas in different parts of the health system.
So it's not a typical internship.
Right. No staples here. No, just, removing staples and making copies and filing and things like that. None of that here. So we have 3 sites have really been hosts for the program: Lenox Hill Hospital, Lenox Health Greenwich Village, and LIJ Forest Hills. Mm-hmm. Lenox Hill Hospital is the primary for the nursing rotation. The healthcare roundtable, it's been a blend of LIJ Forest Hills and Lenox Health Greenwich Village. And then the EMS rotation is a blend of Lenox Health Greenwich Village, and there's some other locations we've had there as well.
So Suravi and Ayannah, you're getting your hands in there. You're getting a wealth of experience. I'd like to know more about you. So I'll start with Ayannah. Tell us a little bit about yourself, and how did you hear about this program, Future Ready NYC, and how did you get selected?
A little background on me. I've always been interested in the medical care field. There are programs in my school called medical assisting, and medical assisting provides internship-like things. And our school, they know that some of the science research kids, which is another program, don't get that opportunity. And someone who wants to be a doctor, that's like big.
So you want to be a doctor?
Yes, I do want to be a doctor, preferably surgery. So one of the guidance counselors really just came to us and, explained what this would be like. And off rip, I was like, oh my God, I'd love to do that. They introduced us to this while we were in class. So it was kind of quick. And I was like, I just hope I get selected. And months later, I got the email from Chatterpall saying that I got selected. And I was like, oh my God, they were like, congratulations. And I was really happy and excited about that. So it was really a quick process. It wasn't, they didn't explain it in depth. They just said that we would be shadowing doctors. And that's what brought my attention to it. And doctors, nurses, things like that. So that's what brought me.
So because of your interest in becoming a doctor, what kind of doctor would you like to become?
So at first, when I was younger, I wanted to be a cardiothoracic surgeon.
Oh, big time.
But then I saw it was like 20 years of school. And I was like, absolutely not. But recently I've been leaning more towards becoming an OBGYN because you get to follow your patients. And I feel like that's something that's very unique when it comes into the surgeon world. Like you can be a surgeon and you meet your patient like a week before the surgery and you see them afterwards, but you don't really follow that person and you don't have the opportunity to create a real bond with that person, especially when it comes with trust. I feel like that's a big aspect in becoming an OBG or being an OBGYN. And I really like that. So that's what I'm interested in.
Well, we have some maternal mortality issues here in America. So we need more OBGYNs.
Of color.
One of color, you're right. And ones that our patients can trust.
100%.
So, Suravi, tell us a little bit about Suravi.
So growing up, my mom, she's a nurse at Wyckoff Heights Hospital in Brooklyn. And my dad also works at Bellevue Hospital. So I've always, lived in a healthcare household. And it's just, they both really inspire me, especially my mom. Currently, she works in labor and delivery. And personally, me, I want to be a psychiatric nurse practitioner. I think I want to do this because I have also had mental health struggles. So I know that there's definitely some issues when it comes to like that field. And I want to make sure that people who struggle have someone to come to, someone to take care of them. Yeah.
Another great field as well. I mean, that's amazing that you're sharing your story and how that has influenced your decision. And you can never go wrong with nursing. And we need more people who care like you to deal with our mental health challenges that we're having. So, Brian, I know you have a rich background.
Yeah.
And so I'd like to hear about that. And also, I know you most recently served as Chief of Staff for Northwell's President and CEO, Michael Dowling. So tell us about that and how did you get involved in this program?
That's a great question. So currently I am the Vice President of Workforce and Community Education. I really focus on, initiatives such as this. I am, an attorney by trade, and I was in private practice for a few years, worked in city government for a few years prior to coming to Northwell in 2016. And I actually started my career at North Shore University Hospital in the HR capacity. And then eventually had, this random opportunity to become, Michael Dowling's Chief of Staff. And this initiative came up from a contact that the city had this initiative that Northwell should consider being a part of. Michael's huge on education.
Yes.
One of the things he always talks about is, you can change the circumstances of a kid from a family with education. And that was something that I really kind of took and ran with. And I took it a step further because yes, it was, change the circumstances of that kid, potentially their family. But I think about the impact that especially this type of generation has on others, and that you could potentially impact a whole generation.
Absolutely.
And so I really wanted to be a part of that. And so, lo and behold, this initiative kind of grew. We had our launch in September of 22, and we had a great, initial kind of kickoff.
So like me, I know you have a passion for mentorship.
Yes.
So I know that you're the right person for this role. But you mentioned pipeline programs, and I know that Northwell has the Medical Scholars Pipeline Program through Hofstra and also the Northwell Scholars Program. So how is this similar or different? Do they intersect?
It's a great point. So we have the Northwell Community Scholars program is something under our community and population health. And that was something, a few years ago, the system, Michael specifically was like, hey, we want to, provide students with scholarships to attend and potentially get a 2-year degree, right? And so that is a program in and of itself funded by Northwell. Same thing with medical career scholars. I'm not that involved with that program, but that's separate and apart, but similar theme. The Future Ready component it's something Northwell is the anchor partner of, but we're not, like, these are paid internships, right? But they're being paid through the city.
So explain what an anchor partner is for our listeners.
Absolutely. So this initiative, the Student Pathway Initiative, so the one prong, as I mentioned, is around apprenticeships. JP Morgan Chase and Accenture, those are examples of two companies who are anchor partners. So basically like the initial companies who are sponsoring apprenticeships for their organization. On the Future Ready side, Northwell Health is the anchor partner on the Future Ready side. We're the first healthcare employer in the city to be involved in this. And, it's huge for us. So we are that initial company on the Future Ready side who has participated in this initiative.
I'd like to hear from you, Suravi and Ayannah. What has this experience been like for you? We'll start with you first, Suravi.
When I first, when I heard about it, I had no idea what to expect because I'd never done anything like this or heard about anything like this. So I really came in blind, like I had no idea. And the first week we had nursing rotations and we met a couple of nurses.